Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related question answer. Part 5. Let's start. The first question. The visual analog scale VAS is used to assess option A anxiety, option B level of consciousness, option C pain intensity, option D muscle strength. The correct option is option C pain intensity. Which hormone is responsible for the let-down reflex during breastfeeding? Option A prolactin, option B oxytocin, option C estrogen, option D progesterone. The correct option is option B oxytocin. A patient is diagnosed with Cushing syndrome. The nurse expects to see option A weight loss and hypotension, option B moon face and buffalo hump, option C hyperpigmentation, option D low blood glucose. The correct option is option B moon face and buffalo hump. Which cranial nerve is affected in Bell's palsy? Option A 5 trigeminal, option B 7 facial, option C 10 vagus, option D 12 hypoglossal. The correct option is option B 7 facial. What is the most reliable method to confirm the correct placement of an endotracheal ET tube? Option A capnography monitoring EtCO2, option B chest X-ray, option C bilateral lung auscultation, option D ultrasound. The correct option is option A capnography monitoring EtCO2. At what angle should an intradermal ID injection be administered? Option A 5 to 15 degrees, option B 90 degrees, option C 45 degrees, option D 60 degrees. The correct option is option A 5 to 15 degrees. Which electrolyte imbalance is most commonly associated with digoxin toxicity? Option A hyponatremia, option B hypercalcemia, option C hypokalemia, option D hypomagnesemia. The correct option is option C hypokalemia. A patient has a Glasgow coma scale GCS score of 7. How would you interpret this? Option A severe brain injury, comatose, option B verbal response, option C eye opening, option D motor response. The correct option is option A severe brain injury, comatose. What is the rule of 9 used for in a burn patient? Option A amount of skin grafting required, option B burn depth, option C degree of pain, option D the total body surface area TBSA affected by burns. The correct option is option D the total body surface area TBSA affected by burns. What does a positive Allen's test indicate? Option A adequate collateral circulation via the ulnar artery, option B adequate collateral circulation via the femoral artery, option C adequate collateral circulation via the abdominal artery, option D adequate collateral circulation via the carotid artery. The correct option is option A adequate collateral circulation via the ulnar artery. How is the estimated date of delivery EDD calculated using Nagel's rule? Option A last day of last menstrual period LMP plus 7 days minus 3 months plus 1 year. Option B first day of last menstrual period LMP plus 7 days minus 6 months plus 1 year. Option C first day of last menstrual period LMP plus 7 days minus 3 months plus 1 year. Option D, last day of last menstrual period, LMP plus 7 days minus 6 months plus 1 year. The correct option is option C, first day of last menstrual period, LMP plus 7 days minus 3 months plus 1 year. What is the Gödel sign? Option A, softening of the cervix, usually occurring around the 4th to 8th week of pregnancy. Option B, swelling of the cervix, usually occurring around the 22nd to 24th week of pregnancy. Option C, softening of the cervix, usually occurring around the 2nd to 3rd week of pregnancy. Option D, none of the above. The correct option is option A, softening of the cervix, usually occurring around the 4th to 8th week of pregnancy. What is the normal fetal heart rate FHR range? Option A, 80 to 120 beats per minute. Option B, 60 to 80 beats per minute. Option C, 120 to 160 beats per minute. Option D, 160 to 240 beats per minute. The correct option is option C, 120 to 160 beats per minute. At what age does the anterior frontal usually close? Option A, 5 to 8 months. Option B, 8 to 10 months. Option C, 2 to 3 months. Option D, 12 to 18 months. The correct option is option D, 12 to 18 months. In biomedical waste management, discarded medicines or cytotoxic drugs are disposed of in which color bag? Option A, red. Option B, black. Option C, blue. Option D, yellow. The correct option is option D, yellow. Koplik spots are a prodromal sign of which disease? Option A, rubella. Option B, mumps. Option C, measles, rubella. Option D, chickenpox. The correct option is option C, measles, rubella. What is the normal range of central venous pressure CVP? Option A, 15 to 20 cm H2O. Option B, 5 to 10 cm H2O. Option C, 2 to 6 mm Hg. Option D, both B and C are acceptable range. The correct option is option D, both B and C are acceptable range. The most common site for a bone marrow aspiration in an adult is option A, sternum. Option B, tibia. Option C, femur. Option D, posterior superior iliac crest. The correct option is option D, posterior superior iliac crest. Which surgical position is used for a vaginal hysterectomy? Option A, lithotomy. Option B, jackknife. Option C, Sims. Option D, prone. The correct option is option A, lithotomy. Which vitamin deficiency causes pellagra, 4Ds, dermatitis, diarrhea, dementia, death? Option A, vitamin B1, thiamine. Option B, vitamin B3, niacin. Option C, vitamin B12, cobalamin. Option D, vitamin C. The correct option is option B, vitamin B3, niacin. Thank you for watching. Please like and subscribe.